Hello guys, welcome back to my channel Ages Kingdom, and in this class you can see in the slide growth and development. It is a very interesting topic from child health nursing I am going to take, and I am sure that definitely I'll give you a good knowledge which is useful for your competitive exams. At the same time it is useful for your all important questions because I am basically a pediatric specialty, and moreover I am very much interested in this subject, so definitely I'll give you a good information. So hi, this is Anita, and in this class I'm going to discuss about growth and development of child. Why this topic? Usually when we speak about any subject, we may study in the medical surgical nursing some disease conditions, but when we speak about pediatric nursing or child health nursing, we are going to discuss about growth and development, because pediatric nursing definition itself says that it is a study or the science dealing with the children. So dealing with children below 17 years. So when we speak, before proceeding for disease conditions, first we should know what is normal growth and what is normal development in child, because growth and development all of a sudden over one day or one night it will not come. It is a step by step process, and it is a continuation process, because you can see the image itself. So when baby born, maybe you can able to sit with support, then once by 1 year able to stand, by 2 years able to run, and by 3 years able to jump, climb, all the things. So like that, so growth and development will be taking place day by day. So that is the topic I am going to discuss in this class. So we'll see what is growth. So we'll say that your child growth and development is not good, your child is not up to the mark of normal weight, like that they will say. So what is actually growth? So when you see, it is a process of physical maturity. Physically what you can see, what you can measure, that is called growth. It is a process of physical maturation resulting in increase in size of the body and various organs, and it occurs by multiplication of the cells and increase in the intracellular substance. It is a quantitative changes of the body. So the word you have to include in the definition. It is repeatedly asked question. Define growth and development. Write the principles of growth and development. Or they will ask a difference between the growth and development. Or they will ask for a 2 marks question. Define growth and development. So here I am saying it is a process of physical maturity. Physically, what you can see is called growth, and it is measurable. That's why we call it as a quantitative changes of the body. Height, weight. So when baby born at the time of birth, it is 50 centimeters, and it may be become double by 1 year, and it will be become by quadruple by 3 years. So when it is showing like it is in measurements, that is called it as a growth. And next one is what is development. It is a process of functional and physiological maturation. So we can say it is a physiological or functional maturity is called it as a development. Baby will grow, and when it is growing, what are the functions are matured in an individual by holding the brush, or by holding a comb, or by standing. What kind of task the child is doing, that is called it as a functional maturity. This cannot be measurable exactly with height and weight. That's why we call it as a qualitative approach. It's a qualitative aspect, and this can be seen by observational skills. This can be seen by observational skills. So it is a process of functional and physiological maturation of the individual. It is a progressive increase in skill and capacity to function, and it is related to maturation and myelination of the nervous system. So it includes psychological, emotional, and social changes. So it is a qualitative aspect. So this is about development. Next we'll see growth and development. It starts from the 0 day of conception. Conception means when ovum and the sperm fertilized together to form a baby. That's called it as a conception. So the growth will start from the conception. It start from the conception, and it only end the person die. So that is the word we can call it as a womb to tomb. Womb to tomb, the growth and development will be continued. So here when we see the growth and development. So first important principle we can see growth and development. It is always cephalocaudal direction, means from head to tail. The growth and development will not takes from the tail to head. It takes from the head to tail. If you see some images of baby when inside the womb, first head will be formed and then the tail and the legs will be formed. So first principle of growth and development is cephalocaudal direction, or we can say proximal to distal direction, means from high level to low level, or top level to superior to inferior. So proximo distal direction, second one. And third one is general to specific. General to specific. General to means child first learn some general things, then only the child can able to go with a specific things. That is the three principles especially we have to see. So this is the word cephalocaudal direction. So the growth and development will starts from the head to tail. The image is showing very clearly. You can blindly write cephalocaudal direction means the head down to tail. This means improvement in the structure and function come from first in the head region, then to the trunk and to the leg regions. So that is cephalocaudal direction. And proximal to distal means the process in starts with the proximal portion of the central to the midline and to the peripheral. The images you can see. And general to specific means children use their cognitive and language skills to reason and solve problems. So here different kinds of things a child starts developing, but here you have to understand very clearly simple things the child learns first, then only will go to complex task, then only go to complex skills. So we can say able to hold the big things by using a both arms, especially when child want to play any toys or bat. First they hold with a big items with the two hands, then later hold with a single hand, then later on can able to pick even the small objects like even peas, cereals, etc. So children when able to hold pencil first starts draw circles and squares, then only letters, after that the words. So this is the meaning of general to specific. Next one is the development always proceeds from general to specific. That's already I explained. No? First they do round circles and all, then they will go with the alphabets. This is a major principles we can see, but still more other principles are there that I will discuss in the later class. So please, if you really like my classes, please do subscribe and share. And definitely I'll come up with a new topics with a good knowledge. And if you have any suggestions, please text me in my video below video. Definitely I will try to rectify and I will give you in a better way of teaching. Thank you. Now please do subscribe and share.